This is an orthokeratology patient that's having some issues with glare at nighttime, and we have baseline topographies as well as a couple of post-road topographies, and we can see that the treatment zone is not incredibly small, but it is getting into the edge of the pupil a little bit, and this is the left eye, and it looks like it's decentering laterally a little bit to the temporal side. So I'm going to bring up some lenses. This is the first lens, or the current lens. I believe this is a proposed design for the second lens. If we look at the maps, patient's getting pretty good peripheral alignment, so I probably would not bring down the periphery more than what you had here. I think you're around 5.7 microns of central clearance. I think that's probably okay for the redesigned lens. Going more will not necessarily help, and we run the risk into getting too much central clearance. I doubt that the patient would end up with a central island this way, but if we don't need to bump up the central clearance, then I just as soon leave it as it is. I think what you have on the original lens is fine. One thing, or a couple things I would change is I think we can go a little bit bigger with this lens, maybe up to 11.5. That will help with the lateral centration a little bit. What you've done is increase the OZ and IC. I agree with that. I think where you have now is going to give you a very generously sized treatment zone. And another thing I would do is probably turn the blending back on. So I found that turning the blending off or checking the box gives us a slightly sharper reverse curve on the topography, but I've noticed a fair number of my patients, the lenses don't center as well. So I like to leave the blending on, box unchecked. We do need to adjust the power a little bit. Because we're going a little bit larger, I would maybe add a quarter to this. So we want to be around maybe a between a 1.25 to 1.3 power, and then we can leave the central clearance at a little bit over a 5 as we had it before. So slightly larger lens. Don't forget to readjust your thicknesses when you adjust diameter. I'm going to let the central clearance drop a little bit. And then let's bump the power a little bit because we're treating a larger diameter zone. Usually we need a little bit more push to get kind of an equivalent effect. At a -1, I think I'll go with the slightly lower one. So something like this, a little bit larger. We've got the larger OZ and IC, relatively same central bearing, and a little bit more power because we're treating a larger area. This should give you a larger treatment zone. Hopefully the lens will center a little bit better, which will also help with the halos and take care of this patient's complaints. So I hope this helps. Best of luck with your patient. Thanks for watching.